My name is Johanna Trimble. I'm a member of the BC Patient Voices Network. We work with health providers all over the province to try and make the healthcare system safer for patients and their families. I got involved in these medication issues because I saw them happen more than once with different family members. My stepmother, Pat, was in an emergency one night. She'd been taken up there because she'd woken up in a very confused state. We went to see her. She could not remember why she was there or how she'd gotten there. And they did test to see if she had had a stroke. She had not. And the next morning, with no diagnosis of what had happened, she was released. At that point, I started looking at her medications and determined that the sleeping pill she'd been on had been the problem. She was taken off that pill by her GP and didn't have any problems again for another 2 years, at which point she was going to undergo bowel cancer operation, and in the hospital waiting for the surgery, she had the same kind of reaction, the same confused state. We recognized it as probably being caused by a drug. We checked with the nurses. In fact, she'd been prescribed the same sleeping pill that had caused the problem and harmed her before. She was taken off the pill, recovered, and was able to have that operation. She lived for several years in a very healthy state after that. Our family's experiences led me to be involved with a research project. It's called ActionADE, which means Action Adverse Drug Event. And this project wants to make sure that the parts of the system that need to talk to each other are talking to each other. The adverse drug event in emergency will be reported to the pharmacare database of all of the drugs that are dispensed. Those reports will then be transferred to the commercial pharmacy, and if the pharmacy starts to redispense a drug that has harmed before, a personal alert will tell them, do not dispense this drug. We're hoping that with this project, it means that ActionADE will be taken up not only by our province, but other provinces in Canada, other countries, where there will be a system that can connect our disconnected systems and keep our citizens safe from being harmed by a drug that has harmed them before.